Welcome again, my good people, and thank you so much for joining this channel. Now, we want to discuss about this particular condition that many of us do miss, particularly when we think of something that is not something. What do I mean by this? Thyroid disease. Many of us normally think that if you have a nodule or a mass in your throat, that is now you have typical thyroid disease. But I want to tell us that thyroid gland is very, very important, and even without swelling, even without having a mass or protrusion in your throat, then you may be having a thyroid disease and you do not know. Now, let's go back a little to some of the physiological processes that normally occurs in terms of what are the function of the thyroid gland. Now, this small butterfly shaped organ situated at our throat area is very, very important in that it normally regulates how our heart beats. It regulates how we have the appetite. It stimulates our appetite. The digestive system, it normally regulates our temperature, even our feelings or our thought. It's very, very important even in terms of how to determine how our heart beats. Now, unlike other forms of diseases that you may not know, this thing can be a silent killer that can present over a long period of time without you not knowing. So that's why we want to talk about what are the warning signs of thyroid disease. Of course, you will be able to know when you notice or you see somebody who has a swollen neck or a mass or even a nodule in the neck. Probably you will be thinking that this particular person is having thyroid disease, and so most people normally call goiter. And when we were young, we knew that if you have goiter, then you don't take the salt, the iodized salt. It is still standing. One of the causes of the swellings is the risk factors is when you don't take the iodized salt. Lack of iodine, yes, bringing the swelling. Now, normally we have the hormones that are produced by the thyroid gland, and these are the thyroxine and thyronine, the T3 and the T4. Now, these T3 and T4 are very, very important together with TSH, thyroid stimulating hormone. This normally regulate all those that we have talked about. Now, if a patient is having excess production of thyroid hormone, particularly the T4, the thyroxine, the patient will present with what we call hyperthyroidism. There's excess stimulation of the thyroid gland in that circle of thyroid gland, thyroid stimulating hormone, the pituitary gland, the hypothalamus. Now, this patient will present with some features. There's a thin line between hyperthyroidism and hypothyroidism, and the purpose of this video is just to let us know that you might have been having some symptoms not related to swelling of the gland, not related to any nodule or a mass in your throat, but these feelings might drive, together with the lab test, which can depict that you have what we call thyroid disease, either hypothyroidism or hyperthyroidism. Now, how will we know that there is excess production of maybe T4 in your blood, causing what we call hyperthyroidism? A patient will have excess racing heartbeat. Your heartbeat will be so faster, and you may seem that you may think that you are having a race. It's called racing heartbeat, but you are not resting at all. At the time you are resting, you feel your heart is beating. A normal person who is very healthy should not be able to feel the heart at sometimes. Only if you have some shock, something has happened, and now you are in shock, you should be able to feel what we call palpitation. Now, you are eating very nicely, you have a well-balanced diet, but you are losing weight. We might be thinking about thyroid disease. You feel shaky, you are sweating uncontrollably. Then we might think that you are having a thyroid disease. Let's continue. Sometimes you might develop diarrhea, thirst, even itchiness of the body, and majorly you may lack concentration. You have poor concentration in whatever you do, and there is some mood swings, anxiety, and even you are fatigued and irritable. And I'd say that there's a thin line. So patients who have hyperthyroidism can present like that. Even erectile dysfunction in men can occur in this scenario. And also remember that when there is a reduced production of hormones, the thyroid hormones, then we have what we call hypothyroidism, which is also not okay. You will become tired, you will be feeling cold, sometimes you may gain weight. Remember, in hyper we were losing weight, now you are gaining weight, despite you are not eating anything good, you are not eating anything, but now you are losing excess weight. Now you may have the muscles, the weakness of your muscle, you are just tired and weak. And then we have pins and needles in both your hand. We normally call them peripheral neuropathy. You will be feeling that there are some things piercing the pins and the needles in your hands or even your feet. So this one you might think of hypothyroidism. You can even have slowed speech or slow thoughts, or you cannot even think well. Likewise in hyperthyroidism, and you may be having low mood swings. So for us to differentiate this particular, because I said there is a very, very thin line between hyperthyroidism and hypothyroidism in terms of clinical presentation. So the only way we'll need to verify this is to do what we call thyroid function tests, of which we'll be able to look at thyroid stimulating hormone. We'll be looking at the thyroxine, that is the T4, and the T3. So in that, we'll be able to diagnose you and put you in a correct drug. So the reason why I'm making this video, I'm not going to into details about thyroid disease. There are very many things that I need to discuss, but I'm bringing this because many of us normally think that if they are tired, if they are sweaty, if they are thirsty, they are thinking of other diseases, perhaps malaria, typhoid, diabetes. But now, sometimes you do all tests, there is no malaria, there is no typhoid, there is no nothing. But when you go ahead and do thyroid function test, you will find that one hormone is raised or one hormone is low. So this is my candid advice to the general population. I made a video, when did you do medical checkup last? These are the things that when you come to the hospital, you should be asking them, particularly when you don't see any swelling in your throat, but you feel all those, and perhaps you are 30s going onwards. We should be able to check you and make sure that you do not have thyrotoxicosis or hyperthyroidism or even hypothyroidism. If you like this video, kindly click the notification bell, written subscribe, turn it on for more videos that will post. Muchas gracias.